I think
Absolutely.
the other thing that we probably 100% need to touch on is the current urology market, which, as you and I both know, there seems to be less and less practicing urologists. Those urologists that are in practice are feeling significant burnout. People are wanting to take less call, and there still just seems to be, right, as many, if not more, patients that still need care. And so our health systems are having to look in different directions of how we are going to really provide the appropriate management to these patients.
Mhm.
You and I are both huge proponents of telehealth. I don't think that's a secret to anyone, but I do want to chat about teleurology and really how it's coming to the forefront. I think you probably have colleagues that may say, no, we have to be hands-on. There's no way that we can do this. Can you talk a little bit about, let's focus on inpatient first. What does this look like for a teleurologist inpatient setting and setting up a teleprogram?
Mhm. So, as you and I have spoken before, I like to separate it out into two different arenas, inpatient and outpatient. And specifically on the inpatient side, we can do exactly what we're doing right now. You have your ancillary staff right there. Say somebody comes into the emergency department, you have your ancillary staff right there. You've got the monitor, and you can see the patient on the monitor, and you can talk to the patient. You can instruct the nurses or the APPs or whomever is there, to put in the catheter, or, you can look at the imaging, you can talk to the patient about the imaging. So there's actually very little that we do need to lay hands on. Usually, if it's an inpatient situation, there is another practitioner there on site. You can direct and basically do, our curbside consults, as we like to call them. We can do that, but do that by telehealth where you have the expertise of a urologist. It's just that somebody else is there. If there truly does need to be hands laid on the patient, then the urologist can instruct that person as to what to do. Especially in the newer ages, APPs, so nurse practitioners and PAs, are being trained to do cystoscopies. So in fact, you can have an APP at bedside doing a flexible cystoscopy at bedside. For instance, if you have somebody that comes in with urinary retention and they can't get a catheter in, well, that person can then directly talk to you and say, okay, I'm seeing this, I'm seeing a pinpoint stricture. Well, that's great. You know what's going on at that point in time. And then you can use your other team approach staff by consulting interventional radiology to place a suprapubic tube, and you bypass the stricture, and basically you get that patient stabilized such that the urologist, if they're not going to be in the facility for another day or so, the patient can then go home because they're stabilized.